Dupuytren's Contracture, trigger finger, arthritis hand disease relief without surgery. Are you experiencing pain and discomfort in your hands? You may be suffering from Dupuytren's Contracture, trigger finger, or arthritis hand disease. These conditions can greatly affect your daily life by hindering simple tasks such as holding a pen or buttoning a shirt. The good news is that there are treatment options available to relieve the symptoms of these hand conditions without resorting to surgery. In this blog post, we will explore natural remedies and non-surgical treatments for Dupuytren's Contracture, trigger finger, and arthritis hand disease relief. What is Dupuytren's Contracture? Dupuytren's Contracture is a hand condition that affects the connective tissue beneath the skin of the palm. This tissue becomes thick and tight, forming lumps or cords that can pull one or more fingers into a bent position. The condition is often painless but can make it difficult to perform everyday tasks such as grasping objects. The cause of Dupuytren's Contracture is not clear, but genetics may play a role in its development. It typically affects men over 40 years old and those with diabetes, liver disease, or who have had previous hand injuries. Symptoms usually start with small nodules on the palm that eventually develop into tough cords under the skin affecting finger movement. Over time, affected fingers may become permanently bent towards the palm, causing limited mobility. While there is no cure for Dupuytren's Contracture, non-surgical treatments such as splinting and physical therapy can help improve hand function. Injections of collagenase enzyme are also available to break down problematic cords, while surgery remains an option for advanced cases if other treatments fail to provide relief from symptoms. What is trigger finger? Trigger finger, also known as stenosing tenosynovitis, is a condition that affects the tendons in your fingers and thumb. The tendons are responsible for connecting the muscles to the bones in your hands and fingers. In a healthy hand, the tendons glide smoothly through sheaths or tunnels within the palm and fingers. However, when you have trigger finger, inflammation occurs around these tunnels, making it difficult for the tendon to move freely, causing a catching or locking sensation when trying to straighten out your affected digits. This can be accompanied by pain or discomfort at the base of affected fingers. The cause of this condition may vary from repetitive gripping motions such as using tools regularly without proper rest periods between usage, or even certain medical conditions such as rheumatoid arthritis, which causes inflammation throughout various body parts including joints and connective tissue. One way to prevent trigger finger is by taking regular breaks during activities that involve repetitive gripping. It's important to recognize symptoms early on so treatment options can be explored before surgery becomes necessary. What is arthritis? Arthritis is a medical condition that affects the joints in our body. It can cause pain, stiffness, and swelling in the joints, making it difficult to move. There are more than 100 different types of arthritis, each with its own set of symptoms and causes. The most common type of arthritis is osteoarthritis. This occurs when the cartilage between bones breaks down, causing the bones to rub against each other. Rheumatoid arthritis is another type that can damage not only the joints but also other organs in the body. While anyone can develop arthritis, it's more commonly seen in older adults or those who have had joint injuries or infections. Genetics may also play a role in developing certain types of arthritis. Unfortunately, there's no cure for arthritis yet. However, treatments like physical therapy and medication can help manage symptoms and improve mobility. In some cases, surgery may be necessary. Living with arthritis doesn't mean you have to give up on an active lifestyle entirely. Either low-impact exercises like swimming or yoga might be beneficial for managing your symptoms while maintaining mobility. How to treat Dupuytren's Contracture, trigger finger, and arthritis. Dupuytren's Contracture, trigger finger, and arthritis are hand conditions that can be debilitating. Treatment options for these conditions vary depending on the severity of the condition and individual circumstances. For mild cases of Dupuytren's Contracture, physical therapy may help to improve flexibility in the affected fingers. Injections with steroids or enzymes may also be used to break down excess collagen buildup in the hand. For more severe cases where surgery is required, there are several surgical techniques available such as fasciectomy or needle aponeurotomy. Trigger finger can often be treated through rest and avoiding activities that aggravate the condition. Splinting can also help by immobilizing the finger joint while it heals. If these methods don't work, corticosteroid injections or surgery might be considered. Arthritis in hands is common among older adults, but younger people might experience it too due to an injury or overuse of joints from repetitive motions like typing or playing instruments. Simple exercises such as squeezing a ball and stretching your fingers regularly could keep arthritis symptoms at bay. Physical therapy can also help to increase strength and mobility, whereas medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, could reduce inflammation which causes pain. Treatment options for Dupuytren's Contracture, trigger finger, and arthritis depend on individual situations involving severity levels along with personal preferences towards natural remedies versus surgical procedures when necessary. Surgery versus natural treatment. When it comes to treating Dupuytren's contracture, trigger finger or arthritis in the hand, there are two main options: surgery or natural treatment. Surgery is often considered a more immediate solution as it can completely remove any affected tissue and provide relief quickly. However, this invasive procedure carries risks such as infection and nerve damage. On the other hand, natural treatments aim to alleviate symptoms through non-invasive methods such as physical therapy, exercise routines and dietary changes. While these methods may take longer to work than surgery alone, they offer fewer risks and can be incorporated into daily life for long-term improvement. It's important to weigh the pros and cons of both options before making a decision on which route to take. Surgery may be necessary in severe cases where natural treatments have not provided relief but should only be used after careful consideration with your doctor. Ultimately, determining the best course of action depends on individual factors including severity of symptoms, personal preference and overall health goals. Pros and cons of treatment options. When it comes to treating Dupuytren's contracture, trigger finger, and arthritis, there are several options available. Each treatment option has its own set of pros and cons. Surgery is a common treatment option for all three conditions. The main advantage of surgery is that it can provide immediate relief from symptoms. However, surgery also carries risks such as infection, scarring and prolonged recovery time. Corticosteroid injections are another popular method for treating these hand conditions. They work by reducing inflammation in the affected area, which helps alleviate pain and swelling. However, long-term use of corticosteroids can lead to weakened tendons and muscles. Physical therapy is an effective natural treatment option that involves specific exercises designed to improve flexibility and strength in the affected hand. This approach can take longer than other methods but provides long-lasting results without any negative side effects. Alternative therapies like acupuncture or herbal treatments may also be used to manage symptoms, but their effectiveness varies greatly among individuals. It's important to weigh the pros and cons of each treatment before making a decision on how to proceed with managing your hand condition. Consulting with a healthcare professional who specializes in this field could help guide towards choosing the best course of action based on your specific needs and medical history. Conclusion. Dupuytren's contracture, trigger finger and arthritis are all hand diseases that can greatly affect your quality of life. However, there are several treatment options available for each condition. Surgery is often the most common approach, but natural remedies such as exercise therapy, medication and splinting have also been found effective in reducing pain and improving function. Before choosing any treatment option, it is important to speak with a medical professional who specializes in these conditions. They will be able to recommend the best course of action based on your specific case. Remember that prevention is always better than cure. Maintaining a healthy lifestyle including regular exercise and maintaining a balanced diet can go a long way in preventing these hand diseases from developing or progressing further. Empower yourself with knowledge about these conditions so you can take control of your health. With the right care and attention, it is possible to live a full life even when dealing with hand diseases like Dupuytren's contracture, trigger finger and arthritis hand disease.